Thank you, Massimo, and thanks for the organizer for the invitation. I'm here actually to present the assembly development progress for the next generation of core inhibitors. As we know, a number of core inhibitors are in clinical development for the treatment of chronic hepatitis B virus infection, and these agents have the potential to interfere with separate and distinct steps in the HBV life cycle than currently approved agents, specifically interference with number one, pgRNA encapsulation and DNA replication, number two, capsid deassembly and cccDNA formation. While first generation of the agents interfere with the first step, they have lower potency against the second step. Assembly Biosciences next generation core inhibitors are optimized against both mechanism, the viral DNA replication, and the cccDNA formation. So what is needed in order to further improve antiviral activity of core inhibitors? First, we need to ensure the pharmacology of those agents to deliver sustained therapeutic concentrations and ensure adequate target coverage against each mechanism. Next, increasing the potency against pgRNA encapsulation, DNA replication, capsid deassembly, most importantly, to introduce additional mechanisms associated with the cccDNA interference. Of course, we need an agent with favorable clinical safety profile. So Assembly is currently developing two next-generation HBV core inhibitors with attributes we believe will make significant progress in core inhibitor optimization. These two core inhibitors are 3733, we call it ABIH 3733, and ABI 4334. A summary of the potency of those two agents were recently presented at HBV International Meeting in Paris in September. This slide summarizes these newer and structurally differentiated agents against relative to the first generation of the core inhibitor, vebicorvir. So with these incremented improvements in potency against the key mechanism, particularly cccDNA formation, we anticipate improved virologic outcomes in hepatitis B virus patients. The next slides, I will review the development status of those two agents. Of these two agents, ABIH 3733 is furthest along in development, having completed a phase 1A study in healthy subjects. This was reported at AASLD 2021. In this study, single ascending doses of 100 milligrams, 250 milligrams, and 500 milligrams were assessed, as well as 250 milligrams for 5 days. These were administered as liquid formulation. A fifth cohort subsequently received an initial prototype of tablet formation at 300 milligrams. This slide summarizes observed adverse events and the lab abnormalities observed in the study. Overall treatment were well tolerated with AEs of grade 1 and lab abnormalities of grade 1 or 2. No increase in ALT observed. In this study with multiple dosing with liquid formulation, we were able to achieve the exposure coverage for inhibition of HBV DNA replication and prevention of cccDNA formation. The initial prototype of tablet formulation resulted in reduced bioavailability. Subsequently, formulation modifications were made. This was presented at EASL 2022. And this improved tablet formulation is now being assessed in an ongoing phase 1b study in hepatitis B patients. As I mentioned before, a phase 1b study with 3733 is ongoing now. The study is assessing 28 days of treatment with 3733 versus placebo in e-antigen positive or e-antigen negative patients. The overall study design is presented here. It is anticipated that the initial data will be communicated by the end of this year. Also, we are currently undergoing the startup activities in 4334, 1A study in healthy subjects. The overall study design is presented here, and the first part of the study is a single ascending dose cohort evaluation, and followed by the multiple dose ascending cohort evaluation for 8 days. We are also planning to evaluate food effect in this study. We are anticipating the first subjects will be receiving the 4334 by the end of this year. As summary, we are moving forward with the development of the next generation of the core inhibitors, and with the improved incremental potency of those two agents on the key mechanisms, especially for cccDNA interference, we anticipate improved virologic outcomes in our patients. With that, I would like to thank our study participants and their families, and also thank our study participating investigators and the staff. Without them, we will not be able to obtain any data.